Assalamualaikum warahmatullahi wabarakatuh. Hello, welcome to Jamie and thank you for taking the time to watch my video. Okay, my name is Rezky Octavia with student number A1M221117. I'm one of the students of the Haluoleo University's English Education Study Program batch 2021. I come from Kabaena, Bombana Regency, Southeast Sulawesi Province, Indonesia. I was born in Baliara, West Kabaena District, Bombana Regency, Southeast Sulawesi Province on April 12, 2003. I want to tell you a little about what I did last night. So last night I made this video to collect before October 16, 2021. My goal in making this video is to fulfill the integrated intensive coursework. In addition, I also want to share a little information about what things I have done to avoid the spread of COVID-19, so that it can be an example for the audience in an effort to avoid exposure to COVID-19. As we know that the coronavirus or severe acute respiratory syndrome coronavirus 2 is a virus that attacks the respiratory system. The disease caused by this viral infection is called COVID-19. Coronavirus can cause mild disorders of the respiratory system, severe lung infections, and even death. This virus can attack anyone, such as the elderly, adults, children, infants, including pregnant women and breastfeeding mothers. In most cases, this virus causes only mild respiratory infections such as the flu. However, this virus can also cause severe respiratory infections such as lung infections or pneumonia. This virus is transmitted through droplets from the respiratory tract. For example, when in a crowded closed room with poor air circulation or direct contact with droplets, holding the mouth or nose without washing hands first after touching objects that have been splashed by the patient's saliva. COVID-19 and close contact with people with COVID-19. Coronavirus can also be transmitted through objects that are often touched, such as money, doorknobs, or table surfaces. In general, there are some symptoms that can indicate a person is infected with the coronavirus. First, fever or body temperature above 38 degrees Celsius. Dry cough, shortness of breath, sore throat, and sneeze. The symptoms of COVID-19 generally appear within 2 days to 2 weeks after the patient is exposed to the coronavirus. Some patients infected with the coronavirus can experience a decrease in oxygen without any symptoms. This condition is called happy hypoxia. To determine whether these symptoms are symptoms of the coronavirus, a rapid test or PCR is needed. There is no truly effective drug to treat coronavirus infection or COVID-19. However, there are some ways to prevent. The best is to avoid the factors that can cause you to be infected with this virus. As I have applied so far, the first thing I do is use a mask when I want to travel. This tool should be used especially when in public places or interacting with other people. Second, wash your hands regularly. However, if water and soap are not possible, use a hand sanitizer with a minimum content of 60% alcohol. Third, when outside the house, make sure to distance yourself at least 2 meters from other people. Fourth, stay away from crowds to avoid the higher risk of contracting COVID-19. Fifth, avoid touching the face, especially nose, mouth, and eyes, with dirty hands. Sixth, clean the items you touch frequently. 7. Cover your mouth when sneezing with a tissue and wash your hands immediately. Then the last thing that's still limited to get everyone is the vaccine. This method is considered the most effective of all things for the prevention COVID-19 and can stop this pandemic. Until it's time to get the vaccine shot, try to continue to apply health protocols and take vitamins and supplements regularly. Well, that's all little information about things that can be done to prevent the transmissions of COVID-19 whenever and wherever we are. We must always apply health protocols to avoid exposure to the coronavirus. I say thank you very much to the audience, and if there are any mistakes, please forgive me. That is all for me. Wassalamualaikum warahmatullahi wabarakatuh.